Hi, Matthew Holt on the HIMSS floor. Now in the Xerox booth, you should be able to see that. And I'm here on the left with Gail Kroll, who is the Chief Medical Officer of HealthSpot. On the right, Tamara St. Clair, who is the Chief Innovation Officer for Commercial Healthcare at Xerox, which many people don't realize does tons and tons and tons of different stuff in healthcare and owns all kinds of little pieces and interesting stuff, and I'll ask her a bit about that in a minute. But let's start with you, Gail. We're actually, in the booth, you've got one of the HealthSpot hubs. You say that right. So tell me a bit about what it is and what it does.
Well, HealthSpot actually brings the doctor's office to the consumer. So it's a 40 square foot station that actually has integrated biomedical devices that allows the consumer to use these devices under the direction of a physician that's virtual. So the physician can actually look in your eardrum and look in your ear, see your eardrum, listen to your heart, listen to your lungs, look at your eyes, nose, look at your skin, and actually make a diagnosis just like they would in the doctor's office.
Great. So we've seen a huge explosion in virtual care over the last years. Obviously, you have companies like Teladoc and American Well, and those folks are doing that. You're seeing some players building themselves, like Kaiser doing it with Target and others. And and I actually had a session at my at Health Duran recently with a bunch of the players, like the Targets and the Walmarts, talking about when they were going to start doing this type of stuff. Give me a sense of where you guys have been around. What, 4 years now? I'm guessing.
It's been 4 years, research and development, doing some pilots with some very large organizations like Kaiser, Mayo, Cleveland Clinic,
right.
Miami Children's. And then really learning from those experiences and understanding the consumer experience, understanding the physician experience, and how do we really start to make it ideal and then start to bring it out into the retail setting. So we've had them within healthcare systems, and now we're bringing it out to the retail.
So they've physically been in sort of doctors' offices or hospitals or around the corner,
right.
and in retail we're talking pharmacy and grocery?
Pharmacy and grocery. A place really there is a pharmacy, so it could be independent pharmacies as well. But we'll be rolling out with Rite Aid in Ohio in the next month to have 100 stations across the state in all Rite Aid stores in Ohio.
Great. And then that connects back to, I've noticed, inside Cleveland Clinic and Metro Health. And how do you go about putting that network of doctors together at the other end?
So it really is a network of doctors that actually are working for the healthcare system. So it's not individual doctors that sign up. It actually is our physicians and physician groups that are part of Cleveland Clinic, are part of University Hospital, that actually are the physicians behind the station. And those physicians, though, the platform that HealthSpot provides is an integrated technical platform that integrates into their physician's practice management system. So it integrates with their eligibility, the insurance that they take, your copay that you need to pay. It integrates into their billing system as well. And major payers in Ohio are reimbursing this just like they would an office visit. So it's the same type of copay that you would pay if you went to see your doctor face-to-face as it would in this kiosk. And then also the information is then put into the physician's electronic medical record. And that's through our partnership with Xerox.
So before we talk about Xerox and some of that integration work, which is pretty interesting, are the hospitals and systems and who's paying for this? Obviously, there's a payment from the consumer. There's payment from the insurer when there's paid. How do you guys get paid? Is this, if the doctors are extending out to the community, are they paying as well?
Yes, it's actually probably a multi-partnership in terms of how it's paid by the health systems, by the physicians, and then also by HealthSpot in terms of providing this service.
Robert. Okay. Tamara, let's talk a bit about your Xerox relationship with HealthSpot to start as we're there. Can you explain a little bit? Are you guys an investor? I know you guys HealthSpot's raised some money. I don't know if you're an investor or not.
So we are capital investors in HealthSpot. The reason why we invested at this stage is we definitely believe they're an important part of the new telehealth wave. And our view in investing in them is to get them up to scale, to scale rapidly and quickly.
And let's talk a bit about that integration we heard about. So there are a lot of people doing the virtual care thing. Some of them are doing it directly to consumer, not worrying about the integration. Some of the companies have spent the effort, and you guys have obviously at HealthSpot have spent the effort integrating back into those practice management systems or integrating into those insurance systems to sort of start figuring out things like copays, insurance information, and the back and forth. I've used some of the virtual care systems where they do that. It doesn't always work, but it doesn't always work in real life either, right? But talk a bit about what Xerox brings to the table there and how you two are working together.
Right. So, I think you bring up a really good point, Matthew. Some of the solutions out there are really reinforcing the fragmented nature of healthcare. And so I think one of the things that we think is important is that backbone that actually creates an integrated network within the HealthSpot kiosk. So what we're doing is we're providing the hosting, the cloud hosting. We do the integration so that the PHR can actually send information, retrieve information from the EMR. And then we're doing eligibility checks and claim submission. And we're the exclusive provider of those services and have a roadmap looking to do other services with HealthSpot as a solution grows and scales.
And I think one of the differences too is compared to other types of telehealth solutions that are out there, we're not hiring the physicians, meaning HealthSpot doesn't hire and create its own provider care network. It really are providers that are participating as part of a health system or part of a large physician group that actually integrates with their practice. So ideally, when you go to our HealthSpot station, you'll be able to see either your physician or at least a physician that practices within your physician's practice or within the health system in which your physician practices.
So you're very much doing this extending the current system of network care. So talking about extending the current, Tamara, Xerox does a lot of different things people don't know about inside the hospital as well as outside.
It's the best kept secret in
well,
healthcare.
you're well kept secret, but getting a bit better known, I think. But as well as all the processing part coming from the acquisition of ACS way back. Tell me a bit about how you see the sort of panoply of portfolio of what you're doing and how this fits into it.
That's a great question. So
I wouldn't ask a bad question. Come on.
So I think one of the things that we see is a major trend that's going on in the industry is patient centricity and consumerism. And I think one of the things that we're doing with our portfolio is, first of all, developing a telehealth strategy, and then looking at the rest of the things we have in our portfolio and understanding what shifts we need to make towards the consumer and towards the patient. It's interesting, an article that we read recently talked about the interaction in medicine really is right now around a patient, and we understand it needs to be around a consumer, that it really needs to be around the longitudinal view of someone in healthcare. So for example, one of the things that we're looking at is the healthcare marketplace, and how do we actually help create transparency around the healthcare interaction and trying to understand what we need to do in that space.
So one of the opportunities, if I can add to that, working with Xerox is the ability to then start to look at bi-directional data. So that as someone is using the station for, let's say, a sore throat or an earache, the opportunity to then have an additional impact on their overall health. So I can take care of your earache, but you know what, Mrs. Jones, you haven't had your mammogram
Right.
this year. Let me help you schedule that mammogram for you. Let me help you. Haven't seen your physician over the past year and a half. Let me help you make that appointment. So the opportunity to really impact a population health strategy out in the community where people are more likely to access is really our goal.
And that really fits in well with some of the businesses we have within Xerox. So for example, we have a pharma and life sciences business, and part of that is medication adherence and working with the pharmacists to actually create wellness opportunities and teaching moments. And we really see a nice fit with HealthSpot in that business, in those types of offerings.
So Gail, I have a sort of question about that. There's a lot of places you could go, obviously. So there is the kiosk itself, there is virtual care in the home using the webcam, like a lot of people doing that. There's all the other Internet of Things devices that are popping up in the home. You've got a bunch of them in the spot as well. And there's capturing information. Where do you think HealthSpot ends up? Do you end up, I mean, obviously your job one is to roll out these hubs and get it going, but do you end up doing more than that, being a service provider for all of that? Or are you going to focus on getting these blue boxes out there around America?
We want to be everywhere. We want to be in the home. We want to be able to provide these same type of services in the home. We want to be able to provide services across the care continuum for the different populations. So wellness offerings, acute episodic, which is where we're starting, but then also chronic condition management, medication management, cost transparency, what's available in your community, what's the cost in your community where you need to go to lab or x-ray, behavioral coaching. There's just endless opportunities for where you can take this type of a solution. The other piece, though, that I think is really important is that what we're trying to do is to access out where people live, where people work, where people play, so that they actually have an opportunity to engage in the healthcare system that's more convenient for them as well. And then if they have to make that trip into the doctor's office or into the hospital, it's that next step. But the primary step really needs to be much more convenient and much more accessible. Certainly, ideally, it's in the home as really the most accessible place. but this is an opportunity to then tie into those other types of needs that you have in the community, whether or not it's the grocery store shopping, it's your picking up your prescription. It's also then looking at how do we start to bring in what I call kind of the influences of your healthcare, the behavioral health aspects when they're seeing in the kiosk, the opportunity to bring in have this in an employer setting.
Right.
So it's just multiple areas where you can use this.
And if I can interject, one of the things that we found attractive when we were developing our telehealth strategy is the fact that HealthSpot had thought about getting into the home and had really thought carefully.
I assume not with the blue box, right?
No,
No,
but
right,
really
an
thought
at-home kit.
through about developing the platform, and which is why the infrastructure is so
Right.
important.
Sure.
So that you actually have, if we use the ATM analogy, the ability to go from inside the bank to outside the bank to a generic spot to doing mobile banking on the phone. And I think that HealthSpot has that vision of bringing that care into the home and has thought about that transition that's required for the paradigm shift.
I mean, as you think about where the digital healthcare is moving, the ability now to do your own home testing, right? The ability to do, get 20 different lab values on one finger stick that you can get right away. The ability to do ultrasounds through your mobile phone. The ability to integrate your Fitbits or your any kind of wellness device into your overall health. The API interface that we have with Xerox and the technology really allows for this ubiquitous platform. And I think that's the starting point of where you then take this in the future.
Very good. So on that note, and to close, Tamara, you guys are working on a lot. You are the head of innovation. So give me some other things that are happening that are exciting within the world of Xerox at the moment.
You mentioned one word, Internet of Things. I think one of the things that we're working with within our innovation groups is sensors that actually have memory, that have power, and so we can imagine smart many things, and we can think about what that can do to healthcare, and creating that connected vision of those smart pieces is one of the things that we're working towards.
Well, I've been speaking with Tamara Sinclair. She's the Chief Innovation Officer for Commercial Healthcare at Xerox. And Gail Corral, who's the Chief Medical Officer of HealthSpot, the company which makes this rather fancy blue box here. We'll do a little video of inside the box in a second, but thanks very much.
Thank you.